Hi everyone, I'm Saurabh Gupta. I'm the CIO at CRMIT Solutions. I also lead the healthcare tech practice there. And welcome to this first episode of Decoding Decisions. We're talking about healthcare today, and I'm really excited to have Dr. Vishnu Reddy with me on the podcast to talk through the specifics of this. Dr. Vishnu is the head of the ENT department at Care Hospitals, one of India's leading ENT surgeons. He's also a facial plastic surgeon, and I'm not mistaken, cochlear implants. And you're the only one of the few people in the world who do this with local anesthesia. Right.
Thank you.
So, privilege to have him on the podcast, Doctor. And thank you for sparing the time. I know you've had a busy day and you also have a flight in a few hours to catch. So, I'm hoping we can make the most of the next 60 minutes. Would you like to introduce yourself differently, Doctor, for your audience?
Moved back to home, Hyderabad, Care Hospitals. I've been practicing there last 23 years. In 2003, I came to Care Hospitals. I had the EMT departments of 3 or 4 branches of the Care Hospitals in Hyderabad. And my practice is basically ear, nose and throat, head and neck surgery, and facial plastic surgery, and of course cochlear implant surgery. These are my subspecialties, my practice.
So really, Doctor, how it all starts for the patient is the onset of symptoms. And the first thing really which patients are wanting to figure out is whether they should really even be going and meeting a doctor.
Correct.
Right. And the first thing which I'm also kind of guilty of doing is putting my symptoms into Google and trying to figure out what the diagnosis is like, and can there be some over the shelf, over the counter medications which I could take, or some home remedy of sorts, right? Is your experience also from when you kind of see your patients, you think they go through a similar thing before they come and kind of meet you?
Yeah, nowadays, because of the availability of the information, yes, people certainly can search on the net and then relevant to their symptoms. I mean, they can find which doctor is going to help them. But sometimes it can be a little tricky as well. Like we were talking about difficulty in swallowing, and then it comes to ENT, if it is at this level up to yes, and then goes down to gastroenterologist. So patient can only express that, right? Difficulty, but he doesn't know whether he has to go to ENT surgeon or gastro or both, right? So these kind of dilemmas can still be there, right? So if it is at this level, throat level, and up to the beginning of the esophagus, then we deal with it, and we check our area and then see if there is any problem we'll address. If not, we will also have to refer them to check with the gastroenterologist, where he'll go down from here with endoscope and examine. So these kind of problems can be faced. It may not be very accurate, but I think relevant information they can still get where to go. If there is a difficult situation for them to decide which specialist to go. These things, yes, certainly.
Right. What has happened, doctor, is with some of the advancements in machine learning and AI, I see the possibility of, especially the larger hospitals, offering something like a symptom checker, which kind of goes through a more structured interview, right? Gathering symptoms and then coming to the diagnosis and then coming to the recommendation of the specialization. Do you see the potential for a solution like this, which is a lot more reliable and safe?
Yes, certainly will be very helpful. If they can symptom checker, if they can enter the symptoms, and then that will guide you. Certainly, I think it's very helpful for a common man to guide them properly. It's certainly big advantage.
But considering the Indian demographics, do you also see that maybe there is a need to support local languages, or maybe even a voice mode?
Correct.
You see that
voice active, certainly his voice activation is there. And also if there is a hospital support system as well along with that, then certainly it will work out very well to to guide them.
Okay. Yeah. Thank you, doctor, for that. So the next step really is the whole appointment booking process. Uh, I know a lot of hospitals have provided mobile apps now, right? But I still feel that for a non-digital native, the whole experience is still not very intuitive. It's still clunky. A lot of times it doesn't work, right? And patients still kind of call the hospitals. Contact centers are busy. What is your observation?
Yeah, I think most of the hospitals, especially the private corporate hospitals, they have these call centers and people sitting there and guiding them. Certainly, I think it will help, but the problem is the delay. One thing, immediately probably they may not get access. That's where is some confusion. Where I think in which case I think certainly the help from the your systems will lessen the waiting time and then guide them in the appropriate way to reach the specialist on time to get the right advice.
Right. That my perspective, also was that while you can kind of simplify the mobile apps, the reason why patients kind of call up the contact centers, because it's very kind of reassuring when you're speaking to a human on the other side, right? Because they are in a state of stress, anxiety, right? They want to speak to a human. While mobile apps might still be an option and they can be simplified, maybe there is scope for us to kind of do a voice agent, voice bot, which kind of replaces the human.
Also language also.
That's correct.
Language is also an issue.
Right.
Voice activation certainly very, very helpful.
Right.
I mean, I do see patients, villages, where they don't know the language. They're coming to see me for certain particular operations. And I ask them how you are coming from a village, and you are telling me that you have seen my YouTube videos about some ear operation or those operations. I mean, came to me, and how are you access me to see me? Then he says, doctor, nowadays voice activation is available.
Oh, okay.
So I can just speak on my, with voice activation that will guide and show me what information I want and what operation I want. That's how I came seeing you. That's what the patients are expressing really.
Okay.
Certainly, I think it's going to be very helpful. Right. If there is voice activation. Right. And language wise also. Right. Can help them out.
So you see that there is a definite option, absolutely viable option. Practically would also work, especially if it is supported with natural language. Correct. Right. The local language support. Right. So once this whole appointment booking process is done and then you're at the hospital, again, one of the key challenges we have seen, right, at least from patient's perspective, is the long waiting hours, right? So you get there, you have an appointment at 10 o'clock. Correct. You probably reach there by 9:30, but then you have to wait hour.
Yeah, that's a very good point. Right. Everyone's time is very valuable, whether the patients or doctors as well. But the problem we face, I mean, physicians, perhaps they can give time schedules, especially if you are a surgeon. That's where is the problem. You are operating and your operation is getting delayed. And that's how that proportionately that will push the appointments away. That's the kind of situation I can think of where the waiting can be delayed. If there is appropriate channel to activate and then inform them, then this problem will not be there. And also we have to face some emergencies as well in between. And we are hard pressed with these sometimes, the hospital atmosphere, especially corporate hospitals and other things. The so-called VVIP, like that. These are all the obstructions. And that's what is the delay. I think certainly, if there is information and access for them to give information to them, and so that they can get the things done and then come at the appropriate time rather than simply coming and waiting. And the doctor is delayed with the operations. And certainly it's an inconvenience which can be helped by certainly your AI systems. Certainly, I think it will be very useful for the patients.
I mean, we tried, implementing something like this, doctor, with our healthcare 360 suite, which we've been working on for a few years, right? We did see some practical challenges, and I thought maybe I'll share that with you, and you can give me your perspective, right? Say, for example, I have an appointment at 10 o'clock, and I have the system in place, and the system sends me a notification at 9 o'clock that the appointments are running late by 30 minutes, 45 minutes, whatever might be the case, right? I might already be traveling to the hospital, en route to the hospital, right? In such a case, it kind of doesn't really kind of help me. And other times, I might just skip the appointment altogether, right? And that defeats the whole purpose of care and, timely care and so on and so forth. So, implementing this practically does seem like a challenge, right?
You need to have a real-time information. So what the doctor is doing, what time he's going to.
Yeah, I mean, that might also be very difficult for you to feed in that data.
That's right.
Yeah. How do you do it now? I mean,
and we actually inform our outpatient desk.
Okay.
And I keep calling the patients on phone.
Okay.
And trying to tell them that, you have to call every patient and then tell this is what is the delay.
Okay.
And then they keep extending the delay like that also sometimes.
Okay, so they manually call
it. They're calling it.
So there is scope for a system, automated system, which could just cascade this.
Yes, if it works out, it's really wonderful.
Right.
It can automatically get the information.
Right.
If someone access and then gives the information, if that activates,
right,
that really is going to be helpful to the people to avoid excessive waiting time.
Sure. Now, the actual moment of truth, right? The consultation, doctor. A lot of times I have, from my personal experiences also, seen that doctors are really hard pressed for time, right? Because of the rush at the hospital, the skewed time patient ratios and so on and so forth. It all seems a little mechanical, right? Definitely not on all occasions, but on some occasions I have seen that. And, as a patient, I feel that human touch is missing because, after the first few minutes, the doctor is kind of really typing away, trying to feed in the history, the symptoms, put in the prescription, and he has to, or she has to possibly do this all within 10-15 minutes. And that kind of really sometimes defeats the, the human touch which is required, in such cases. What are the challenges, doctor, which...
Again, it depends on the experience of the doctor as well. How quickly he is able to, knowing the symptoms and then doing the right things and right diagnosis. That's where the experience also matters.
Right.
But at the same time, like your symptom checker, if you have something readily available, quickly you can, tick. So these are the symptoms. And then, of course, quick examination. We see, whether in my area, of course, we had to check the ears, nose and throat with some telescope or something to get some conclusion. But certainly we can speed up the process of consultation.
Right.
Of course, at the same time, you have to satisfy the patient as well, listening to them carefully. And then based on the symptoms, if we can, if AI can help and hasten the process of taking these symptoms, and then the common problems are there.
Right.
So the common problems, you can generate a common prescription.
That's right.
Actually, of course, that's what is simply if you take tonsillitis or some allergic rhinitis kind of things. So the prescriptions, if you can generate, then with a little modifications, I mean, it's some minor suggestions. Like if the patient has some allergy, you can avoid. Again, the antibiotics choice, and then based on the problem, certainly we can speed up the consultation process.
Right.
At the same time, of course, you have to satisfy the patient as well, listening to them, and then information should be recorded.
Right.
And then finally the treatment.
Right. Right.
So all these things can be incorporated with some help, which can hasten the process.
Right. Right. From your experience, doctor, do you see a lot of the EMR, EHR systems? Do they have these kind of capabilities built in, or are they kind of yet to come?
We have some systems where you have the symptoms can can be taken quickly,
right,
and then of course the examination is finally the thing, how what you examine, and what's the diagnosis. Yes, common things can be incorporated.
Right.
Most of the problems are common,
right.
Whoever the specialist is dealing with. So certainly, because all the information can be incorporated and come to a quick conclusion, which will be helpful to the patient and for the doctor as well, to speed up the things.
Right.
Where certainly, I think the role of the artificial intelligence kind of thing certainly will help to speed up the process.
Really using the patient's longitudinal profile data, and then some of the patterns you see to make that data, it really help in making the right decisions. Right. Wanted to bounce off one idea, doctor. Do you think there is potential for a solution which records the whole consultation in real time? Right. So as you're kind of conversing with the patient and maybe the patient's relatives, all of this voice data is kind of being recorded, and then you extract some of these data points. How do you see it from a privacy and a compliance perspective? Do you see any challenges with these kind of solutions?
The problem is sometimes you see the patients and also the relatives also will be talking. That is one thing.
Right.
And I think privacy is, I don't think it's an issue. Privacy has to be maintained by the doctor, and the patients also wants privacy as well. But for the common problems, I don't think privacy is a big issue.
Okay.
And it's all information is all is confidential.
Right.
To be maintained.
Right.
So privacy is not a major issue.
Okay. Because I mean, AI does have the capability to kind of strike off any of that privacy, personal health and other information. So that's an option which you can kind of always leverage with these kind of technologies, so that only the parts which are really relevant to the consultation and to the outcomes and the patient's clinical details, only those kind of get captured in, right? So that's a definite possibility there, doctor. Thank you, doctor, for all of these insights. Really, really, really valuable. One question which I had, doctor, is actually with the Modi government, there's a lot of focus on digitizing healthcare data with the Ayushman Bharat digital health mission. Do you see this kind of really panning out practically on the ground? Do you see this happening with the hospitals, at least the major hospitals?
I think the problem is, yes, it's happening, but it's not in all the states.
Okay.
So, especially where I'm working in Telangana, and I don't think it's happening.
Okay.
Each government have their own way of doing things.
Right.
They have a different system called Aragyasri or something. So they're not joining here with the thing. But of course, everyone can register in this Ayushman Bharat thing, and collecting this database, the huge database, is certainly is going to be very, very helpful in future, in the long run. If all the states come together with the common thinking and for the best benefit of the common man, then I think everybody has to join. And then only it will be fruitful. It's not the few states, not few ruling states for ruling party. So I think it should be a combined effort. I think that will make it successful. And also the problem is the private hospital setup and government hospitals. So that's where is the issue as well. most of the government hospitals, yes, they are ready to accept this. But the private hospitals, as I see, as working in a private corporate hospital, the charges of for the procedures, that's where is the problem.
Right.
That has to be addressed.
Yeah.
The charges should be reasonable
Right.
for the hospital to accept
Right.
and perform the procedures.
Right.
Because consultations can be done,
Right.
advices can be given
Right.
in medical point of view. When it comes to surgical point of view only,
Right.
there the issue comes in.
Right.
So to accept these, Ayushman Bharat
Right.
procedures,
Right.
I'm not sure at the moment. I think when it was started, the charges are not really acceptable to the private hospitals.
Right.
So
Right.
that was the issue was there.
Okay.
But now I think if the things have changed and if they have, escalated the matter and then got rectified, I don't know the current situation because Telangana is not going to these Ayushman Bharat. So, but certainly I think it's a wonderful idea. I think it should be helpful to the whole country if all the states follow.
I'm glad you brought up that point of healthcare costs in the private sector. The way I really kind of see this, right? I know we were discussing about data and the application of AI in the narrow context of a patient. When you're really able to kind of do this at scale, right? Because we are trying to bring in efficiency that will naturally kind of reduce costs, right? And make healthcare more accessible. If all of this can be done at scale, powered by data, right, and to really kind of see patterns, go in for prevention rather than probably an actual episode, right? Because that's where healthcare costs kind of pile up from primary to tertiary. And that cannot happen until you kind of really digitize this data, especially some of the challenges which we've seen with some of these AI solutions and AI stacks in the healthcare space is that they still kind of rely a lot on Western data. They really don't have high quality enough Indian data sets, right? Which is where the accuracy suffers, right? Because there are the demographics and all of those kind of have an important role to play, right? So that's what our observation has been. Have you seen, because you also kind of have been in the industry for almost 40 years now, you've seen governments, right?
Correct.
Do you see at least a push for the better now? I mean, do you see the government is I know you spoke about Telangana not focusing, but generally across India,
Yeah.
do you see a move for the better now?
Yeah, certainly. I think there is a lot of change happy, and more people are utilizing these services. I do hear from other states, and then they are getting benefit out of it. And I think certainly it's a matter of time. I think things will change, and if the motive is good, I think all comes to the all the governments come to the same platform of helping the common man. Then I think certainly there will be appreciation, and then we move forward. In the future, is where revolutionary change will happen if all join together for the best benefit of the common man.
Yeah.
Certainly, in this context, certainly the data and information and AI has a significant role in the near future.
Right. Thank you, doctor. I wanted to talk to you about teleconsultations. You kind of really took off during the COVID times.
Correct.
Do you see that as a practical option, or do you see that trend kind of really balancing? Out a bit more?
Teleconsultations are certainly good for the common problems. Most of the common problems can be addressed. So I think the physician level consultations, and also it saves time, traveling time, and and then waiting times. All those things can be cut down.
Right.
Certainly there will be, it's a good thing happened.
Right.
The COVID time, I must say.
Right.
Certainly the most of the common problems can be treated by teleconsultations.
Right.
Provided you authenticate the prescription.
Right.
To get the medicines from the pharmacy.
Right.
I think it's certainly is going to be very, very helpful if you all follow that.
Right. And it could also kind of possibly help reduce care costs as well, because
it reduces the cost. The problem comes here is only when the patient needs surgery, then the patient has to be examined physically. Then only we get the conclusion of what is the diagnosis, what is the surgery. But medical management, which is a common thing, I think can be easily done. And it will be very beneficial.
Post the encounter, post surgery, whatever that might be. Follow-ups could be
for post surgery follow-ups. Yes, certainly. And also during the surgery and post-operative monitoring of the data, post-operatively following the patient.
That's right.
And following the continuously monitoring the status of the patient. Also, certainly there will be significant benefit with the artificial intelligence.
Right. Because if you don't do that, that really defeats the purpose of the surgery or whatever care has been kind of extended.
That's right.
Patient really has to recover
and then alert.
Yes.
For if there are any changes. Certainly, I think a significant role. As 24 hours, as we cannot monitor. The systems can monitor and alert the doctor to interact and do the timely help. And that's really great advantage is going to be.
And the symptom checkers which we spoke about could be utilized in this phase as well. Once you're home, kind of use these
absolutely
AI agents to probably diagnose some minor symptoms just to make sure that it's not going south from there. And just really progressing in the right direction. So, Doctor, one of the things which I wanted to ask you is about our Healthcare 360 suite. Actually, we started back quite a few years back. You've seen the evolution.
Yes.
From the days when it was kind of a much leaner solution. The focus was always keeping the patient at the center. Very unlike possibly an EMR solution, which is more clinical. This is more focused on experience. From where it started to now, wherein you have a lot of AI agents now embedded into the system, and some of those agents we briefly, loosely touched upon as we were going through the challenges. Is there a specific feature or a specific agent in the current Healthcare 360 suite which stands out, Doctor, to you?
I think the Healthcare 360 is certainly being helpful, I see nowadays. Because if you have the lab reports of 15-20 pages.
You talk about the path report assistant.
Path report assistant, yes. So you have to go through you have to spend a lot of time. But nowadays, because of the advantage of Healthcare 360, it is picking up all the abnormal results and then showing it immediately when you open it. The first page is, information is already there. So you don't have to go through 15-16 pages. It's only highlighting the abnormal out of range. It is just giving quickly in the first page itself. That has been very helpful to save the time.
Okay, thank you. What we've also done is in fact, to that same assistant, we've also added a voice interface. Now you can talk to the agent and then it gives you the abnormal readings, using voice as output. That's one of the more recent changes.
We've done. Even more helpful.
Great. The other thing, Doctor, we've covered a lot of the primary care, most of the key moments we've covered, like to kind of slowly move into tertiary care, and really wanted to check with you, when you are deciding on a particular procedure or a surgery, do you really have access to quality data around the patient, especially the longitudinal profile, the real history over a long period of time? Because surgery is very complicated. It is very interdisciplinary. You need a lot of parameters to decide precisely what the right procedure needs to be, if there needs to be a procedure in the first place now, or it can kind of wait for some more time. Do you see that you have access to more data now, and hence that kind of really helps you make these decisions better? Do you see that is the trend?
I think the common problems common surgeries, because most of the departments have some common surgeries happening, every department. So in those cases, certainly is going to make a difference.
Okay.
You have the common data which can be fed and then get an opinion quickly. Of course, you always need a final human touch
Right.
to change, make a little bit changes based on patient to patient. You may have to have some changes, but otherwise, common surgical problems,
Right.
with the data, having a previous operations, previous patients,
Right.
if we can analyze and give a quick solution,
Right.
certainly it's going to be very helpful and to shorten the meditation making and certainly common things it can be. Of course, rare things may not be addressed, but the common problems can always be addressed with the quick data in hand, and then we can give the advice quickly, and it saves the time.
So you say you're confirming that you do have enough data, but you kind of briefly mentioned shorten the period. So it takes a lot of time because there's so much data. Someone has to kind of manually go through it. Maybe it's not you, it's your team.
Right.
And you see that there is a possibility wherein you can use AI, or machine learning to kind of decode all of this data and act as a kind of a reliable assistant to you.
Yeah.
Right. So there is scope for something like that.
It is certainly it will be helpful.
Sure.
But some difficult situations you may have to have additional.
Yeah. Okay.
Otherwise, for the common problems,
Right.
can be quickly treated.
Right.
With the help of machine learning.
Right. Right. I mean, the doctors will always stay in control. This
Yeah.
is just an assistant.
Absolutely.
And that's how it needs to be, at least for at least a few more years, right?
Very true.
This technology is evolving. You don't know where it's going to go. But that
Yeah.
human in the loop angle, the
Correct.
doctor in the loop angle always has to be there.
Yeah. In certain specialties like dermatology, it will be very helpful.
Right.
By just seeing the the lesions
Right.
on the skin or so.
Right.
And then the artificial intelligence can easily pick up the diagnosis and the treatment can be advised. In certain specialties, certainly it's going to be very, very helpful.
Important.
By seeing the pictures and images
Right.
of the patient and the previous images stored.
Right.
Compare, and then you can quickly come to a conclusion.
Right.
Of course, finally the doctor has to approve.
Right. Absolutely. Right. Thank you, doctor. This has been really, really insightful, right? Because we are on the other side, we are looking at healthcare from a technology lens, and it's important that, some of our, some of the thesis and some of our understanding gets vetted by someone from the other side, right, who's really knee deep into healthcare. So this has been kind of hugely valuable for us. And I'm sure it is for the audience as well. Would you like, Doctor, to just kind of summarize things a bit for us? Give the healthcare providers a doctor's perspective, how technology, digital technology especially, could be of help.
Yeah, certainly data to decisions making is going to be revolutionized in the future. As we spoke through, when it comes to in terms of seeking the appointment of the specialist, and also the waiting times, right? And also the quick voice activation, and then collecting the patient clinical symptoms and coming to the decision making about what treatment has to be advised for most of the common problems. And certainly there will be great benefit using the technology and to quicken the process of the, whether it is appointment or consultation time or waiting time, and then the management size, whether it's the common medical problems, and then the addressing common issues, definitely is going to be a huge benefit in the near future. No doubt about it.
Right. So I'm sure we're going to be partnering a lot more from here on, Doctor. Thank you. Thank you once again.
So much.
Right. It was really kind of very, very appreciative of you being here and spending this quality time with us. I hope this was kind of really, really helpful for all of you, right? We kind of gotten deep into healthcare and tech and how, these kind of intersect with each other, right? And how really at the epicenter of it was data, and how data can kind of power some of these decisions in healthcare and make healthcare more accessible, more equitable, for everyone in the country. This is just the beginning. I'm sure there are going to be more podcasts happening in the future. So this thread will continue from here. Watch out for us on YouTube, and if you have some comments or if you have a point of view, feel free to kind of put it out there. We'll meet soon again. We'll be back soon with another episode of Decoding Decisions. Bye bye.